Hello and welcome everyone. I'm Melissa from the Massachusetts Health Connector. I'm joined here by my colleagues Nikki, Talia, and Nuri, who will be presenting today's information. Together, we are here today to share information about the Health Connector's open enrollment and walk you through some of the helpful tools available. We'd like to take a moment to thank our community partner organizations and elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, just some information about our presentation format. Everyone's audio has been muted and video has been turned off. The presentation portion will last approximately 30 minutes, then we'll have time for a question and answer period. If you would like to ask a question at any time, please use the Q&A button at the bottom of your screen. We will be monitoring your questions throughout, and I will note that we are expecting a large crowd as well as several questions. So we will do our best to address as many questions as possible. You may not hear your question asked in the same way it was typed into the chat, so please listen carefully as it may be answered more broadly. Please do not share any personal information or private health information when you ask your question, as others on the call are able to see what you write. If you have a personal scenario that you want to discuss with someone, we'll be providing contact information for the Health Connector's Customer Service Center and instructions on how to find help from a local assister. We are recording today's webinar. Following today's session, you will receive an email with the presentation, so there's no need to take detailed notes. Lastly, at the end of the webinar, we ask kindly that you stay on and complete a short survey that will help inform our future sessions. So let's get started. Talia will kick us off.
Thank you, Melissa. Okay, so hello and welcome everyone again. In our presentation today, we'll give a brief overview of the Health Connector enrollment periods and their deadlines, how to apply and update your application, updates and eligibility for our ConnectorCare coverage, how to save on your monthly premiums, and where to get help applying for coverage. And then we'll also go over some other resources that are available to help you select the right plan for you. All right, so just a quick overview of who the Health Connector is. We are the state's health insurance marketplace for individuals, families, and small businesses, and we provide access to affordable health insurance. Those who shop for coverage with the Health Connector are usually those who can't get insurance through their job, their spouse's job, or if you have a part-time job that does not provide health insurance to their employees. The focus of our presentation today will be health insurance for individuals and families, but we also provide dental insurance, and some of the plans available through the Health Connector have limited vision benefits, but members should reach out to carriers directly to see what exactly is covered with their plan. Next slide. So when shopping through the Health Connector, you can be assured that all plans meet state and federal standards of coverage. When applying for insurance through the Health Connector, you'll choose from a variety of plans based on the area where you live. And because the Health Connector is the state's marketplace, we have benefits and programs that can help reduce your monthly premiums. We have advanced premium tax credits, which I'll go over in more detail later in the presentation. And we have ConnectorCare plans that are unique to Massachusetts and is based on an individual or a family's income level. Those eligible for a ConnectorCare plan may now qualify for low or no cost health insurance. And we will also talk about ConnectorCare plans in more detail later in our presentation. So on this slide, you'll see all the health insurance companies in Massachusetts that offer plans through the Health Connector. All insurance companies who participate in the Health Connector also offer plans in our ConnectorCare program, which means more health plan options for Massachusetts residents. So now we're gonna go over some enrollment periods and key actions and deadlines for this period. And in this section, we will also go over how to apply and update your application. So we are currently in a closed enrollment period, which runs from January 24th to October 31st. And during this closed enrollment period, you must have a qualifying life event that will open up a special enrollment period in order for you to apply for coverage. So although we are in our closed enrollment period, I want to talk to you guys today about our open enrollment period, which will begin on November 1st, so just in a month. We're during this open enrollment period, new and existing members can apply for new coverage or renew their coverage through the Health Connector. So open enrollment for plans that will begin in 2026 will begin on November 1st and run up until January 23rd. During this time, you will have the opportunity to review the plans available on the Health Connector for coverage that will begin on January 1st. Existing Health Connector members will have the opportunity to review these plans as well as select a new plan if they would like. Health Connector coverage will always begin on the 1st of each month. So for anyone seeking coverage that will start on January 1st, you must select a plan and make a payment by December 23rd. Okay. So if your qualifying life event happens to be losing a job-based insurance, I just wanted to take a few minutes to discuss COBRA. The Health Connector is an alternative to COBRA coverage. Many companies may offer their past employees COBRA coverage, but that does not mean that you have to accept it. When you lose coverage through your job, that'll open up a special enrollment period where you'll be able to enroll in a Health Connector plan outside of our open enrollment period. So, for example, if you lost insurance through your job in the month of September and need coverage to begin on November 1st of 2025, you can apply for coverage now, make a payment by October 23rd, and you will have coverage that will begin on November 1st. But again, this is only for those with a special enrollment period. And I do want to note that if you choose to enroll in COBRA, you will not be eligible to apply for coverage with the Health Connector again until our next open enrollment period in November. So this is for future references, obviously because our open enrollment is coming up in just a month. But if you were to miss our open enrollment period and needed coverage, and accepted COBRA coverage, you would need to wait until our next open enrollment period in November, unless you had a special enrollment period. Okay. How to apply and update your application. So you can apply for coverage on our website, mahealthconnector.org. The application is available in English, Spanish, and Portuguese, if that is your preferred language. The Health Connector and Mass Health use a single application to determine which coverage you might be eligible for. You do not need to know if you are applying for Mass Health or the Health Connector, as the system will make that determination once you enter your personal information. If you have filled out an application with us before, please don't make a new account. Instead, call customer service and they will help you access your account. So, as I previously mentioned, both new and existing members can shop for coverage that will begin on January 1st, but the process might be slightly different for existing members and new members. So we'll start with existing members first. Our existing members already getting coverage through the Health Connector do not need to complete a new application. You just have to log into your account and make any necessary updates, including any income changes or changes to your household size. You'll then review your eligibility and provide any document proof if any are requested from you, and you will have 90 days to submit these documents. And lastly, you will select a plan, pay your premium if you owe one by December 23rd, and your plan will begin on January 1st. And so for our newly applying members, the only difference will be that you will not have an existing application, so you will have to start a new application. But the other two things still apply. If any proof is needed, it will be requested from you. You will have 90 days, and then you will still have to make that premium payment by the 23rd for coverage that will begin on January 1st. And I just want to say for our existing members, if you have a plan, if you already are enrolled in a plan and you choose to change to a new plan for 2026, that plan will start, the new plan you select will start on January 1st, and you will remain with your old plan until then. So there are a few qualifications you must meet to get coverage through the Health Connector. You must live in Massachusetts. You must be a U.S. citizen or be lawfully present in the United States. You cannot have or be offered health insurance through an employer. You cannot have public health coverage like Mass Health or Medicare. Next slide. Okay, thank you. So for our newly applying members, when applying for coverage, you'll need the following information. You'll need your social security number for everyone applying, your immigration documents, and income information, including copies of your pay stubs, net income for those who are self-employed, and monetary determination if you are receiving unemployment. So if you don't have all this information at the time of the application, that's all right. Just provide us with the information that you do have, and then we will follow up requesting more information if we do need it. So one of the questions that we often get is what income should be included when reporting on your application. On this slide, you'll see what sources should be included and those that should not be included. The information is also available on our website if you would like to review it. Additionally, it's important to keep your income and application up to date to make sure that you get the right amount helping to pay for your coverage and lower the risk of owing money to the IRS at the end of the year when you are filing your taxes. You can log in at any time and update your income information, not just at the time of completing your application. So after submitting your application, we ask that you check your mail from the Health Connector and Mass Health to make sure that no additional information is being requested from you. Any documents you owe can be submitted online through our website within a 90-day time frame. And I'll say this again, please make sure to update your application if there are any changes to make sure that you and your families will get the right amount to help pay for your health and dental insurance. All right. And now I will pass it over to Nikki to give us some updates on the ConnectorCare program.
Thanks so much, Thalia. And again, thank you everyone for joining us today. So I'm going to get into some additional plan details, particularly talking about our ConnectorCare program. Okay, so as Talia had mentioned at the top of the presentation, there are a couple of different ways that you can get help paying for your coverage through the Health Connector. And again, this is exclusive to getting your coverage through the Health Connector because the Health Connector is the state's health insurance marketplace. So Thalia mentioned advanced premium tax credits and also mentioned our ConnectorCare program. Now, advanced premium tax credits are just as the words try to describe. They're tax credits that you're able to use in advance. And depending on the amount of tax credits that you're eligible for, they essentially lower the premium amount you pay each month. Now, those dollars get sent directly to the insurance company that you enroll in, so you just simply pay less each month. And as a consumer, depending on the information that you provide on your application about you and your household, you may find that you get a certain amount of tax credits that you can utilize. You can choose to not take advantage of all of those dollars. You can actually limit or change that amount. Um, and sometimes people do this if they have, let's say, they're running a small, like they're contracting in or consulting, and they are actually don't have a steady income. So sometimes people will choose to decrease that amount of tax credit and not take the full amount. Now, separately, well, actually, in addition to advanced premium tax credits, we have the Connector Care program. And this is when consumers get to use their federal advanced premium tax credits plus additional state dollars, and those two together reduce the monthly premium that they're required to pay. Now, the Connector Care program has low monthly premiums, low out-of-pocket costs, and no deductibles. So these are comprehensive plans, and essentially, members just get to take advantage of lower costs. Now, as we're looking ahead to plan year 2026, we just want to alert everyone to some Connector Care program changes that you should be aware of. Specifically, these are due to federal policy changes, and there are two major impacts to the program for the upcoming year. So important to note is that the Connector Care Plan Type 1 is going to be eliminated. So that means those individuals and families who have income under 100% of the federal poverty level will no longer be eligible for advanced premium tax credits beginning on January 1. Really important to note is that if you are currently a Connector Care Plan Type 1 member, you do have that program, that coverage in place through end of this calendar year. In addition to that, Connector Care Plan Type 3D may be eliminated. So the Connector Care eligibility includes a requirement that individuals are also eligible for advanced premium tax credits. And right now, the current federal enhanced premium tax credits are set to expire at the end of this calendar year. So if it turns out that those enhanced advanced premium tax credits do not continue, um, Connector Care Plan Type 3D will be eliminated. So we know that this is a lot of information to kind of consume. It's pretty nuanced. So if you want to learn more about this, or if you're currently a Plan Type 1 member or a Plan Type 3D member, we really encourage you to go to the Health Connector's website at mahealthconnector.org and go to, it's mahealthconnector.org/updates. We have a dedicated webpage which describes these federal changes and what this might mean to you. So on this slide, I just want to talk more about the Connector Care income limits for eligibility, and also you'll notice how some things are changing and shifting for next year. So as we've already mentioned, Connector Care has much lower premiums and copays and no deductibles for any of their plans. So right now for this calendar year, the Connector Care income limit for an individual is $75,300. So anyone earning up to that amount could be eligible for a Connector Care plan. As we look to next year, there's actually an income range for eligibility. So that income range is listed here as 15,629 through 62,600 for an individual. Again, for right now, if you had a family of four and you needed coverage for the remainder of this calendar year, that income limit is 156,000. And then as we look to next year, it is an income range for eligibility. So a family of four would need to be making approximately 31,150 to 128,600 for household income to be eligible for a Connector Care program. Now, we haven't talked about the coverage types yet, but I just want to explain this briefly as it shows the different plan types somebody might be eligible for based on their income level. And also what the lowest cost plan would be in a particular plan type, depending on whether or not a person chose to enroll in the lowest cost plan. So if someone applied right now, and my colleague Melissa will be going through a demo showing you how to, if somebody was newly applying and it turned out that they were eligible for a plan type 2B plan right now, if that person wanted to enroll in the lowest cost plan, you can see that that cost is $51. As we look ahead to plan year 2026, that monthly premium, if they stayed in that same plan, is increased by $2 and it's a $53 plan. So, similarly, if someone was enrolled in a plan type 3C right now, that the lowest cost plan is $226. If they stayed in that same plan in 2026, that plan would cost $235 per member per month. Now, I know we're in kind of a transition period, as I know that there are people who are seeking coverage for this calendar year, and there are also people who are trying to learn more about getting coverage for 2026. So we are working to update all of our materials, including ConnectorCare program rates for 2026. When you receive this presentation, you can click on the link for the Resource Download Center and you can take a look at our shopping guides, which will include that information. Now, as we're thinking about shopping, comparing, and ways to save money, I just want to provide some tips and some more understanding about what is currently available to help guide you. So there are lots of considerations when shopping for health insurance coverage, and the Health Connector has a variety of tools that can help you compare your options. So the first thing that people typically look to is the monthly premium. So again, a premium is what somebody pays each month to be enrolled in that coverage. Now, the plans that are available on the Health Connector each have a set of covered benefits. And those benefits basically are the services that are covered by the plans. As a member of one of those plans, you may also have out-of-pocket costs that you need to pay in addition to your monthly premium when you use any service. And of course, important to note, and probably the piece that is a little bit more nuanced and you need to understand is that each plan has an associated network that's contracted with that health insurance carrier. So specifically, it is the doctors, the specialists, the hospitals, other facilities that you may want to use services from. So depending on what your healthcare needs are, you may be in a position to choose a plan that might have a more limited network and essentially save some money when you are enrolling in a plan for next year. So these are some of the tools that we have available. And the first one is a Get an Estimate tool. And that really lets you see what plans are available in your area of Massachusetts. And this tool gives a very rough estimate of what your savings might be. I say that it's a very rough estimate because you do need to complete an application and provide a lot of information to get the accurate eligibility determination and accurate costs that you would be paying. However, it does a great job of estimating whether or not you're going to be eligible for advanced premium tax credits or whether or not you would be eligible for the Connector Care program. And my colleague Melissa is going to step through this tool and use an example of someone who is newly applying for coverage for 2025. We also have a plan comparison tool, and this lets you see if your providers, medication, or facility is specifically covered in a plan. So Melissa will also be stepping through that. And then lastly, when you do complete an application, you can see, based on all of the information that you've provided to us, if your preferred providers and facilities are covered through specific plans, and you'll see the monthly costs. So again, this tool is available only when you've completed your application and you're in your personal application. Now, whether someone is newly applying or you are a current Health Connector member and you're ready to shop, you can go to our website, mahealthconnector.org/renew. And this is where we have a renewal, essentially, it's a renewal page that will guide you through all of the steps one by one. This page will not be live until November 1. You can certainly go to it now and you'll just see a notice that says we're currently not in open enrollment, but if you need coverage now, apply now. Now, in terms of talking about enrollment, we need to talk about billing and payment as well, because a person chooses, when they're going through their shopping process, they're going to choose their health insurance plan that they want to enroll in, but shopping isn't complete until the premium payment has been received and processed. So that's when enrollment is done. So if, for example, someone is seeking coverage for February 1, they need to enroll and pay by January 23rd. If it's right now and you are seeking coverage for November 1, you need to complete your application, make some decisions, and do all of that by October 23rd in an effort to enroll in coverage or be enrolled in coverage November 1st. Now, if somebody got a bill for a premium that they weren't expecting, and this is really during open enrollment, Leah mentioned open enrollment runs from November 1st until January 23rd. So if somebody, kind of got through January and they're looking at a bill and they're like, okay, this still is, I can't afford this. This is not what I was expecting. Really, you have until January 23rd to make a change, and then those changes will take effect on February 1st. All right. This is just a sample of what a monthly premium bill looks like. And again, this is for January 1st January 1st coverage. The bill is due on December 23rd. And when you're making a payment, it can be made a couple of different ways. You can make a payment online. You can pay by mail. So you would write a check, send it in with your payment coupon, or you can pay over the phone and essentially just enter your account information. We are always asked, so I think it's important to note that at this time, we're not able to accept credit or debit card information to make a payment. However, we do have the ability to set up auto pay, and people can do that by providing us with their account, either a checking or savings account information. So plenty more detailed information on how to pay on the Health Connector's website. And again, you will get these slides and all of its related links. Now, we know that we've covered a lot of ground today, and you may be thinking, okay, I get the gist of this, it's process. However, are there people available to help me as I'm going through this process? And the answer is yes. So there is free enrollment assistance available through the Health Connectors Customer Service Center, as well as across Massachusetts in person through community partner organizations. Our customer service number is 877-623-6765. Or for people who are deaf or hard of hearing, speech disabled, it's 877-623-7773. And we'll find out before this webinar is over. I believe we have a new shorter number too, of course, that you can reach out if you need TTY. Now, on our hours of operation, you can go to our website to see that. Typically, we're open from 8, customer service is open from 8 a.m. to 6 p.m. However, during open enrollment, we do offer extended hours. And then also during open enrollment, it's a good idea to go to our events page and see if there's any local community events that you could take advantage of and talk with a local support person. Now, to provide you with some additional information about our community partners, these are individuals who are trained and certified as navigators or certified application counselors. And they work at organizations across the state, and they speak many languages that can help someone with the process of applying all the way through enrolling in health plans. They can help you answer questions about eligibility, the application, payments, plan details, etc. Now, we really recommend, especially as we're getting closer to the start of open enrollment, that if you want to use the support of a certified application counselor or a navigator, to make an appointment in advance, use our tool to find free help near you and essentially just schedule a time to talk with them. And as I said, they are able to assist, and it's free of no cost to you, free of charge. Now, some folks who may be on this session and thinking about health insurance coverage may be nearing Medicare, maybe nearing eligibility for Medicare. So we just want to remind you of some resources that are available for individuals who are over 65 or anyone who is Medicare eligible. These folks are known as Shine Counselors, and they can provide you with free help understanding your Medicare eligibility and helping you with applying. And if you want to schedule an appointment with the local Shine Counselor, you can call Mass Options at 800-243-4636, or you can email shine@state.ma.us for more help. Now, I want to call upon my colleague Melissa if she wants to join me again. I can't see you yet, so I apologize if you're already there. You are.
I'm
Um,
here.
thank you. And I just wanted to hand over these slides to you so you can just talk about this new applicant who is looking for coverage.
Okay, great. Thank you so much. So what I'm going to go over is a couple different scenarios. We have a new applicant who's looking for a plan. They're eligible for ConnectorCare Plan Type 2B. They don't have a PCP, but they know they have a chronic condition that they used to take medicine for. They like to get care at the Family Health Center of Worcester. So what I'm going to go over is what shopping tools can they use to compare their plan options for the remainder of 2025. Okay. So there are a couple of ways that we can go about looking at these different scenarios. So for the first one, the member information, we have a member who probably doesn't want to go through the whole application process, but just wants to get an idea of exactly how much they'll save and exactly how much the cost would be. So in this scenario, if we put in basic information, such as this example here, where this is a person who has a household of one, their age is 36, they provided us an income of 25,000 a year and their zip code, we can use the get an estimate tool to get an idea of what they are eligible for, how much they would pay, and if they would qualify for any type of assistance. Then, once we get through that whole process, we need to do the next step, which is extremely important. We need to make sure that whatever provider or medication or hospital or facility that that person goes to is actually in network with the plan that they are selecting. And we have a plan comparison tool to allow us to take a look and see whether or not the plan is in fact in network. So let me just show you real quick. I'm going to go ahead and share my screen.
And Melissa, I have stopped sharing mine, so you should.
Okay. Can you see mine?
Yes, perfect. Thank you.
All right, great. Let me just, okay. So this is our homepage. If you click on www.mahealthconnector.org, this is it brings you to our homepage where we have all sorts of different resources. But the one that I want to use to show you the first scenario is actually the Get an Estimate tool. So if we go to the right hand side and we hover above Get an Estimate, we can see two options here. We have individuals and families, and then we also have businesses. But we just want to click on individuals and families. So just give that a quick click. And then if we scroll down just a little bit, we can answer the basic questions that we have here. So this person, if you remember, they're applying 2025, so that's already clicked for us. We want to enter the zip code that was in the scenario, and that was 01610. And then we enter the income here for the year, and in that scenario, it was 25,000. And then if you remember, there was only one person in the household, and that person was 36. And then if you look to the right here, we have a few more options, and we definitely want to pay attention to these options because this also determines eligibility. So we click the most important one, that this person does need coverage. And then we just look to see if this person is pregnant or this person is disabled or blind. We don't have that information, so we will just click that they need coverage. And then we want to go to our results. We have a quick reminder here that this isn't an application for health coverage, and that's fine. So we just want to continue. Okay. So now we have a breakdown of the estimated eligibility for this person. So based on what this person had indicated, they do qualify for an advanced premium tax credit to help lower their monthly premium cost. So the maximum tax credit is $437. So they are eligible for silver plans with monthly premiums as low as $10.41. Now, it would be $10.41 if they choose to use the advanced premium tax credit, which actually helps lower the cost. So then we see the potential eligibility. We see that this person is eligible for the ConnectorCare plan with an advanced premium tax credit. And this is great news because this means savings. So then we can go and click on Preview Plans. So here we have it further broken down with estimated savings details. So again, we show here that this person is eligible for a 2B ConnectorCare plan, that their tax household federal poverty level is considered 166%, and that they are eligible to receive an advanced premium tax credit of $437, which is huge savings for this person. And then if we continue to scroll down, we see that this person has some options here as far as plans. So it's basically broken down to carrier, plan name, coverage level, monthly premium, the advanced premium tax credit, the Massachusetts state savings, and then exactly how much they would pay per month. So just as an example, I'll just go over the first one real quick. So if this person wanted to select the WellSense health plan, they would take their monthly premium, which is the $447.41. They would then go ahead and subtract the advanced premium tax credit, which they are awarded, and that's $437. And that basically tells you how much the person is responsible per month, which is the $10.41. So this is great news for this individual. They see here that the savings are huge. So this is great. So here, if you continue to scroll down, you do have an option if you're excited, you want to apply now, do the official application, you have that choice. Or you can start over, you can put in another person in the household, or as changes occur, you can play around with the get an estimate tool just to get an idea of, how much you would pay and be responsible for. So this is great. So now that we have determined that, okay, maybe I want to get the WellSense health plan, just as an example. Now we need to check to make sure that the provider or medication or facility that the person goes to is in fact in network. So I'm going to go over the second scenario. And if you go to Help Center above on your screen, you'll see a few options here. So we're going to scroll down to our resource download center, and we're going to click on that because we want to get to the provider tool. And here we are. So this is our plan finder tool. Is a very great resource to use to see whether or not your current provider or medication is in network. So we just click on use the 2025 Plan Finder tool. And we just follow the directions just like we did for the Get an Estimate tool. For this one here, we select individuals and families and we continue. Okay, so now we have to answer a few brief questions. So if you remember in the scenario, this person's zip code, we will enter that. I believe it was 01610. And this person did in fact qualify for a ConnectorCare plan as we saw in the example. And their plan was a type 2 plan. So we just click on that and then we continue. Okay, so in the example, this person did not provide a doctor, but if you had a doctor, you would just simply put their name here. But for this scenario, we don't have that, so we continue. But what we do have is the facility name, and that was Family Health Center of Worcester. So we click on that, and then we continue. And this person is on a asthma medication. So we put the medication name. But then we have a few more options where we just want to make sure that the dosage form and strength is also selected. So for this example, this person was on a dry powder and 90 is the strength here. So let's see. Okay, so it would be the dry powder inhaler and then the 90. So we just click on that. And then now we're able to compare plans. So what we see here for this individual, they have 7 plans available. So basically what this shows us is the medication that they're on and their facility, and whether or not they're in network with the plan here that you see available. So, as an example here, I'll use the first one. It's HMO Blue Connector Care 2. And then you'll see the category your drugs. But then if you hover above C list, you'll see the medication that we have provided. And then you'll see like a check and it says in plan. So that simply means that this is in network with this plan. Then if we go to the right, remember we did not put a provider, but we did put a facility. And it also shows that the facility that they go to in their area, the family health center, that's also in network. So this is just a great tool to basically kind of see exactly what would be the best plan. You see that everything here is in network. So based off of the cost from the get an estimate tool, and now based off of this information that we're seeing that these plans and what is in network, we can finally make a decision on which plan is the best one. So this is super helpful, gives you a quick, guide to see before the application process exactly what you need as far as picking a plan and your savings. Okay.
Thanks so much, Melissa. I'm going to try to reshare the deck right now. Um, I think, hold on, I might need you to stop sharing, but I don't know if that in fact is true. So let me try.
Okay.
Are you seeing the PowerPoint?
I see it. Yes,
Okay,
perfect.
great. Thank
Okay.
you so much. Thanks for walking through that scenario and then the two tools. I think that's super helpful for people to see. And again, these are tools you can use right now and just play around with them. Um, One other thing, we don't have to demo it just because I know we're running low on time, but I know we want to answer some questions. I just want to acknowledge that people can also make a payment directly from our website, and this is the link to get to it, and they're step by step. We promise we'll do this demo next time. We are always available to do these sessions. So you can also look at past recordings that we have done. Um, and perhaps if folks on the back side are ready, we could take questions. I know everyone has been super busy answering questions, but maybe there are a couple of themes that we want to explore a little bit further. And as Melissa said at the beginning, if we weren't able to answer your question exactly, you might hear us talk about your question generally because many people may have had that same question. So I will look, I'm going to see if I can see everyone's camera now. I don't know, Melissa, if there are any, if you had a chance, if you were looking at the questions and you saw any themes, or if the Leah wants to ask any questions. Related to themes. And I apologize, I do see one participant has raised their hand, but we're not able to unmute on these sessions. So if you'd like to ask a question for us to consider, please drop it in the chat. Is it chat or Q&A? Q&A. Please drop it in the Q&A and we will do our best to either respond directly or answer thematically.
One of the questions that I see coming up a few times is questions about PPO plans available through the Health Connector, or if we only have HMO plans.
That is a great question, and the answer to that is yes. All of the plans on for individuals and families are HMO plans. So thank you very much for asking that question because that's not something there. It's not something that we've stated directly. And give me a moment. I can also check and see. Typically we have questions about,
And I just want to answer this question because I see it coming up and I realize that I did not mention Health Connector for Business for small employers. We do have webinars for Health Connector for Business separate from these individual and family webinars. I can send the link now to the person who asked this question for our next one that is coming up on October 8th.
okay, great. And I do see like a related HMO question that I'd be happy to respond to. And it was, does an HMO cover expenses outside of Massachusetts? And essentially, you would have to check that plan's evidence of benefits and coverage to see whether or not there are out of Massachusetts benefits. So typically what happens is if somebody has an emergency outside of Massachusetts, yes, those things are in fact covered. However, if you are looking to get routine care, so an example we use all the time is if you, as part of your family, you have a student that goes to school outside of Massachusetts, we recommend that they can, of course, have that coverage outside of state if there's an accident, emergency. However, their routine primary care or specialist visits need to occur in Massachusetts in network with their regular physicians when they come home.
Nikki, can I jump in here and ask about vision? Some folks are curious to know
Yes.
what's included, and then I'll circle back with the second question.
Okay, so vision benefits, I think we talked about this very briefly, but happy to just go through it in more detail. Um, Generally speaking, we do not have standardized, well, first of all, we do not have separate vision plans that the Health Connector sells. We also do not include vision as a standard benefit in our Health Connector plans. So some plans do in fact offer eye exams, or other services, particularly if someone is a diabetic. If you are trying to get more information about a particular plan that you're enrolled in or interested in enrolling in, I would recommend that you compare, you narrow down your options. As Melissa was showing you, you can use that the plan comparison tool. So narrow your options down to a couple. And then you would want to look at this either the summary of benefits and coverage for a high level information about those plans that you're comparing. If you still don't see anything about vision, you could go to more plan details and look at their I believe it's called their plan detail document. And you can check to see what level of vision benefits they cover, if any.
Thanks, Nikki. I also saw a lot of folks asking about not necessarily speaking to someone on the phone, but just getting help with their application, whether it's in person or setting up appointments was a recurring thing. I know you spoke about this, but can you just remind folks on how they can proceed?
Sure, sure. So, you know what? I'm going to promote our navigators here because I know that they do, in fact, do this quite a bit. If you go to find local help or find help near you, essentially you can click to find a navigator that's in your area. And the way this works is that once you make an appointment with a navigator, they'll ask you, are you able to come in person? Do you want to talk over the phone? Do you want to do a Zoom visit? They'll figure out what your preferences are. The two of you have to do that together. Then you need to sign a form just confirming that you want their help. And the two of you will, they'll go through that process with you. And once that form is signed, you can work with them over Zoom, over the phone, however you need to get this quote unquote business done. And you can give navigators permission to make calls on your behalf, etc. So really, really want to stress that working with a navigator in your community is a great idea. They're great resources and they can really help people stay on top of and keep up with their health insurance coverage, not only their application, but if your needs are changing throughout the year, they can help make sure you keep your application updated, etc. Um, any other themes? I'm seeing some question. I saw just a question. I'm not seeing a question about Cobra. Um, And I think this is always a great scenario to talk through because I feel like it was something that I never saw really happen until after COVID. So this one individual is saying that they were separated from their job and they accepted Cobra, and that the company was subsidizing that Cobra for a period of time. If those subsidies are ending, once those subsidies, if you know those subsidies are ending, so in this example, the subsidies end at the end of this month. This person has the ability to apply for and enroll in coverage through the Health Connector beginning on November 1. There is no need for them to wait until open enrollment starts. Um, so because the company is no longer going to pay for part of that coverage, basically that in and of itself is going to give you is a qualifying event that gives you a special enrollment period, so you don't have to wait for open enrollment. Um, any other questions that people want to call out? Because I just saw another one that I want to answer if it's okay with all of you.
I have seen a couple questions come up about HSA plans.
Okay, great. So HSA plans, essentially HSA stands for Health Savings Account. And a health savings account is essentially a plan that you open outside of the Health Connector where you're able to contribute pre-tax dollars. Then there are certain Health Connector plans that are going to be HSA compatible plans. As we move into plan year 2026, I believe we have many more offerings that will be available. So what we'll do is we can follow up when we send the follow-up email to all of you. We can provide you with some additional information about the HSA compatible plans, because my understanding is that we are offering, I believe the carriers, I don't want to misspeak, I believe the carriers each offered two HSA compatible plans for next year, but I will confirm that and will message all of you with that information.
Nikki, can you share for folks who are already enrolled in the Health Connector and have
Yep.
had no income changes, no household changes, what their next steps are for 2026?
Yeah, sure. Happy to talk about that. So if someone is an existing Health Connector member, and I'm going to use the example that Melissa had used. The person was making around $25,000 a year. They're in a plan type 2 plan, and it's just them. Even though they're thinking, okay, nothing has changed for me. I would still recommend that they go into their application and just review all of the information that they had provided. Um, if nothing has changed for plan year 2025, no action is needed. If nothing has changed for them for plan year 2026, they don't need to make any updates. However, it would still be in their best interest to compare their options and just be sure that the plan that they're currently enrolled in is still the best plan for them for next year. Now, for people whose income or let's say something else in their household has changed, if someone is now pregnant, you would want to update your application to indicate that because that will allow you to get additional benefits. if someone, if your household size has changed. I know I saw some references to people in the household, etc. The law allows individuals or tax dependents up to 26 years old to still be part of your household and to still have coverage with you. Um, However, you may have someone, a child, an adult child living with you who is not a tax dependent. Last year they were, this year they're not. If they're not a tax dependent anymore, meaning they file their own taxes, you still want to go into your application and update and say, no, I no longer have a household of three, it's a household of two. So those are the types of things you'd want to do. And essentially, then you know that you're prepared for plan year 2026. I hope that was general and specific enough. Ooh, and I just noticed the time. I just noticed that it's 1:01. I want to be respectful of everyone's time, and I know that it looks like we still have questions that are coming in. We can certainly go through these and just see if there are any other themes. We do send a follow-up email with links to resources on our website, FAQs. As I said, I will provide more information on HSAs. And if there's anything else in the unanswered questions that we can guide you to, we absolutely will. Melissa, I'll let you close us out because I know we are hoping that people will complete a survey.
Okay, thank you so much. Yes, thank you all for joining our webinar today. From everyone at the Health Connector and all of our assisters across Massachusetts, be safe and well, and don't forget to complete the survey at the end.